Hey everybody, it's Curtis again for our EMR class. We are at Chapter 16, Childbirth. We're on the downhill slide here. We've only got about 5 or 6 more chapters, and we're going to knock this thing out. So, childbirth, let's get started. So it's a completely normal and natural part of life. What we've got to remember in EMS is that this was going on long before the times of ambulances and paramedics. This is a completely natural and normal part of life. And because of the way that we do things now in your position, you may be called on to assist in this. But, you know, if you remember some easy steps that we're going to talk about, you can assist in both the birth process and you know, support and comfort and all of that to both the mother and the newborn. So, you know, remember, it is a normal and natural part of life. So you may not have time or even the necessary assistance to transport a pregnant woman to the hospital. So you may have to, you know, become part of the scene here. So, your part of the process is going to involve several different things: helping and guiding and supporting that newborn as it's born. You know, following birth, you'll probably want to ensure that the newborn is breathing adequately and being kept warm, because those are two really big important parts. Now, there will be times when the timing of the childbirth catches everyone by surprise. So you're on the side of the highway, and sometimes just, you know, on a Sunday afternoon at home, and, you know, this can be some quite surprising things. Also, though, some complications can develop, and that can cause some problems too. So a couple of different indicators that you'll find in your book that are key indicators of an impending birth: frequency of contractions, and then crowning. So appearance of the newborn's head during a contraction. That's another word for that, is crowning. Now, quick little A&P lesson here. So the major female reproductive organs, we're talking about ovaries. The uterus is one thing that we'll talk about. So the ovaries produce the eggs. The eggs released by the ovaries, these things travel through the fallopian tubes to the uterus. When everything works properly, they travel through the fallopian tubes to the uterus. And the uterus, or the womb, holds that fertilized egg as it develops during a pregnancy. So during the newborn, that baby's encased in an amniotic sac for support, and then it just floats in that amniotic fluid. And then placenta, or afterbirth, it draws the nutrients from the wall of the uterus. And these nutrients and oxygen, they're delivered through the umbilical cord to the baby. And then obviously we can see with our picture here, our anatomy of a pregnant woman. You know, you have that external opening where that baby's going to come from, the birth canal or the vagina. Now, stages of labor. So first stage of labor, you know, pregnant woman's body starts to prepare for birth. So this stage is characterized by some following conditions. Initial contractions occur, the bag of waters breaks, you have a bloody show, or you might think of, you know, mucus plug. Newborn's head does not appear during contractions. We're just in the first stage. So, you know, you want to check, make sure that the baby is not crowning. And then in the event of what's going on, and you're on scene at someone's house, you want to make sure you're relaying this information to the oncoming crew. So the second stage, involves the birth of the newborn. So you'll see that newborn's head crowning during those contractions. At that time, you must prepare to assist the woman with delivery. No time for transport. We're going to make a baby right here, wherever we are, whether that's on the side of the highway or that's in someone's living room. And then the third stage is the delivery of the placenta, or another word that you might hear is afterbirth. So you must assist in stabilizing that condition of mom and newborn, and then delivering the placenta if that comes up as well. Sometimes that does, sometimes it doesn't. Just depends upon the time frame. Now, when we start thinking about, is there time to reach the hospital? Because that's typically most of our first thought is, do we have to do this here? Can we get somewhere else to where this is a better place to do this than here? So some of these questions you're going to want to ask. You know, you want to determine how close the pregnant woman is to delivery, and then whether or not there is time to transport to a hospital. So is this their first pregnancy? A woman experiencing her first labor will usually have more time to reach the hospital. Usually people that are having their first baby, it takes a lot longer than those that have had several prior. And then has the woman experienced a bloody show? If yes, then the first stage of labor is about to begin. And then also has the bag of waters broken. So bag of waters usually breaks towards the end of the first stage of labor and can give some idea of the progress of the birthing process. So how frequent are the contractions? If contractions are more than 5 minutes apart, you can usually transport to the hospital depending upon how far out you are. Now, if they're less than 2 minutes apart, though, that typically indicates that the delivery is going to happen pretty soon. You need to just go ahead and prepare because you're going to have a baby wherever you are. Now, also, something is a very important question is, do they feel an urge to move their bowels? So when the newborn's head is in the birth canal, it presses against the rectum, and the woman may feel the urge to move her bowels. So one thing is, you don't want to let them go to the bathroom because it's not uncommon in this moment that a baby can end up going into the toilet, because that urge is not for them to actually go to the bathroom. That urge is actually for that baby that's causing that urge. So what that urge is telling us, though, is that indication that delivery is imminent. So we just need to be prepared. Is the newborn's head crowning? So when crowning indicates a newborn will be born in the next few minutes. So, can we see that baby's head? And then also, is transportation available? So is the ambulance responding? How far is it away? How far is it to the hospital? What about weather? What about traffic? All of those type of things as well. Lots of questions. Now, timing contraction cycles. So, you want to time the contraction cycles from the beginning of one contraction to the beginning of the next. Now, if those contractions are less than 3 minutes apart, then delivery is going to be close. So, timing those contractions can be a pretty important piece of this puzzle, because that gives us an idea about what we can expect very soon. Now, detecting crowning, we're going to observe that vaginal opening, that birth canal during a contraction. If you see the head crowning during the contraction, you need to prepare for delivery. So you don't want to risk transporting a woman to the hospital if the child's head is crowning, because you more than likely are going to have trouble with that and probably not make it. As you prepare to assist the patient in delivery, we want to keep two things in mind. So, calm woman, calm yourself. So the calm woman delivery, it's a completely natural process. And then remember, for you, you're there to help. And you're going to have a hard time helping if you're all wound up and can't focus on what you're doing. My apologies. Oops, sorry. Siri had something to say. So, one thing to think about, you'll not be able to maintain sterile conditions. You need to be as clean as possible, but it's not going to be a sterile procedure. So wash your hands good. If you don't have a sterile delivery kit, use gloves from your EMR life support kit, whether you have a little belt pouch or whatever you have. If you don't have an OB kit, then you're going to have to just do with what you have. You're going to want to have plenty of clean towels. You've seen on the movies probably, but we're not going to boil water and tear towels into strips. You do want to have these clean towels, though, because they're going to cover the newborn, and you're going to need to help clean mom. One of the biggest things we're going to do is clean baby up and keep him or her warm. And then you want to put the patient on a firm surface. If it's padded with blankets and sheets and towels, that's even better. But when you do that, what you'll do is you'll elevate their hips somewhere between 2 to 4 inches with pillows and blankets, trying to get yourself some room to work, and place them in as most comfortable position as they can. Typically, that's on their back with their knees bent and the feet flat on the surface beneath them. Standard precautions. So what we need to think about with standard precautions. So as you can expect, if you've never been on a childbirthing call, it's a mess. So lots of blood. I shouldn't say lots of blood, but there can be blood, but lots of body fluid. So you're going to need to use standard precautions during delivery. Now, one thing you don't want, you want to do your best at not getting this stuff all over you. I don't feel like I probably need to tell you that, but it is on here. So we want to not get this stuff on us, because it's just pretty yucky, honestly. If you are able to use sterile gloves, if you have the you have those in an OB kit or whatever you have, that's a good time to put these on. Now, fluids can splatter on your face during this delivery process. As you imagine, you kind of have this compartment that's full of stuff and a lot of pressure behind it. So in the event that you have face and eye protection, wouldn't be a bad time to wear it. If you don't, just don't stick your face, right there, because that'll help lessen the chance that you get stuff splashed on you. And then in the event that you have a surgical gown, that might help keep you off your pants and your clothes and all. Now, hopefully you have an OB delivery kit. If you do, that includes a couple of things: sterile gloves, an umbilical cord clamp, which both are pretty important. Sterile gloves are not as important as that clamp. Those clamps are pretty important. But you also got sterile drapes and towels. You see all the things listed: 4x4s, towel or blanket for the newborn, a bulb syringe, which is going to be pretty important, plastic placenta bag. But nearly all of these things you can probably find in the kit that you have, or something just around your station or around that person's house. You can find suitable alternatives. But certain things you can't, like a bulb syringe. You really need to be able to have a bulb syringe. Sheets, towels, suction if available, O2 if available, newborn size face mask. Hopefully you won't need that, but in the event that you do, you hopefully have a newborn size face mask. Now, if you do, like I said, if you don't have that delivery kit, then you're going to need to find some adequate alternatives, So when we look at this, we're seeing that we have a mother and we have baby. So you have the life of the mother and the life of the newborn. You don't want to neglect to perform a patient assessment on mom. Don't let baby take all of your attention, because mom has an opportunity here to be kind of sick. So one of the things you want to do is you want to determine whether they have any medical conditions, whether the baby has any medical condition, mom has any medical conditions. You're also going to want to find out if baby has been, maybe they're a high-risk delivery or something like that, what has been going on in their life up to this point. So you want to get a baseline vital signs. You want to repeat them at least every 15 minutes if everything's going fine. Throughout this whole process, you're going to continue to monitor. We're talking about mom, so we're going to continue to monitor her ABCs. And once again, our primary purpose to be there is just to assist in the delivery of the newborn. Now, we want to make sure, we mentioned this before, we want to make sure that we don't let mom go to the bathroom. Do not let her go to the bathroom. And we don't want to hold her legs together. It may seem for a split second that seems like a good idea, because maybe it'll delay things, but it doesn't. Baby's coming, so you got to be ready. So be as clean as possible throughout this whole process. If you can, that's going to help things out as well. Now, the newborn's head hopefully should emerge slowly to prevent undue stress on the newborn. It also will prevent the tearing of those vaginal tissues. So what we want to do is, as the head emerges, we want to support the newborn's head and then tell the woman to stop pushing. You don't want to attempt to pull on the newborn, though, during delivery. So what happens is it creates a bunch of force, and if they push too hard and you are not able to kind of control the delivery, then she'll get kind of tore up down there. So in a normal birth, newborn will turn its head to the side by itself after the head emerges, and the rest of the body will be delivered spontaneously. Now, that baby is going to be wet and slippery, so make sure that you're prepared for that. You do want to keep the newborn's head somewhere right about the level of the woman's vagina, back from the birth canal, so you don't get a lot of pressure changes going from baby to mom. Now you see some phases here. You see these. You see the head begins to deliver, and then you see the delivery of the head, the delivery of the upper shoulder, and then delivery of the lower shoulder. So this is kind of the process of how everything should work when everything's working correct. So if the amniotic sac has not broken, you want to tear it with your fingers and push it away from the newborn's head and the mouth. If the umbilical cord is wrapped around the newborn's neck now, that can be quite a little bad situation. So you want to attempt to slip that cord over the newborn's head. If you cannot disentangle that newborn from the umbilical cord, you're going to need to attempt to reduce the pressure on the cord. We don't want to pull on it because it's extremely fragile, but we want to do our best to get some space put in there and get that cord unwrapped off of baby's head. So we're talking about caring for the newborn. We might need to make sure that we clear the newborn's mouth and nose. What we talked about was we need to have that bulb syringe. So if you have that bulb syringe, you want to clean the mouth out. You want to clean the mouth first and then the nostrils. And you want to rotate that a couple of times, get everything good and clean. If nothing else, we've talked about our ABCs, right? We've kept things kind of in progressive order of our alphabet. Well, you can do the same thing here. M before N, mouth before nose. What happens is you can stimulate a kind of a breathing reflex. But once you go into the nose, you'll stimulate that breathing reflex. And if the baby has some stuff in their mouth that hasn't yet been cleaned out, they can easily aspirate it into the lungs. So make sure you do M before N. We want to clean their mouth first and then the nostrils. You want to repeat a couple of times, like I said. Make sure you wipe everything off. And then place the newborn on the mother's abdomen. You want to help keep them warm, and that's one of the big things with these babies is keeping them warm. So suction the mouth and nose, want to make sure we're getting all that stuff out. Mucus, amniotic fluid, all of that stuff out using that bulb syringe that we talked about. Mouth first. If the newborn's not breathing, then we're going to suction the mouth and nose again. Make sure that we're rubbing that newborn's back or flicking the soles of the newborn's feet. What we're trying to do is we're trying to get the baby to stimulate their breathing. We're trying to get them, kind of started here. So you want to use a towel to dry the newborn and then wrap the newborn in the blanket. You can kind of rub vigorously with that towel to make sure you get them, a little bit wound up and everything's going well, because the more they cry, the more they're clearing their airways out and all of that. So we want to make sure that, we're doing a good job here. So then you'll move on and you'll place that newborn on their side with their head slightly lower than their trunk. What that will help do is aid some of that drainage of secretions from their airway. And then when the umbilical cord, when it stops pulsating, we'll make sure to clamp it with the umbilical cord clamps. You can also just tie it with some gauze or something like that, and you're going to do that between the mother and the newborn. Now make sure that we note the time to delivery so it can be reported on the newborn's birth certificate. Now, in rare events, your book will tell you, use the words rare events, you encounter multiple births. You do have to prepare for a second delivery, so be prepared. After we get through all of that, we move on down to our last bit of the delivery of the placenta. So that placenta usually delivers on its own in somewhere around 30 minutes after delivery. We don't want to pull on the umbilical cord to help deliver the placenta. You can cause some real problems with that. So leave the umbilical cord uncut and attach to the placenta and a newborn until transporting EMS unit arrives. Now, once that placenta is delivered, we're going to wrap it in a towel with 3/4 of the umbilical cord. We want to put it into a plastic bag, transport it to the hospital. You want to keep it at the same level as the newborn. Okay, small glitch. So we do want to keep it at the same level as the newborn, as I just said. The reason for that is we want to prevent that blood from the newborn flowing back into the placenta. So if the mother's bleeding usually stops, it usually stops after the placenta is delivered. However, if it doesn't, you may need to massage your uterus to help stop the bleeding. So the way we'll do that is you can place one hand with the fingers fully extended just above the mother's pubic bone. What you're doing is you're kind of doing what's called a fundal massage, and you're allowing that uterus to kind of harden up. So you'll use your other hand to press down into the abdomen using a circular motion and gently massage your uterus until it becomes firm. That should take somewhere in the neighborhood of just a couple of minutes. And then it actually hardens up and the bleeding for the most part will stop. Aftercare of the mother and newborn. So we want to continue to observe the mother and the newborn carefully and keep both of them warm. So we'll cover the newborn's head and its body to prevent the loss of body heat. About every 3 to 5 minutes, we're going to make sure that uterus, became firm, because like I said, once that becomes firm, then typically we see a lot less bleeding that can happen. And then we're going to look for any excessive bleeding that we talked about. In a normal delivery, mother's going to lose around 300 to 500 mils, so 1 to 2 kind of cups of blood would be kind of expected. Continue to massage the uterus using a circular motion. If it's not firm, or if the bleeding continues. So you'll notice it'll be soft and squishy, and then you'll do that fundal massage, and you'll have to do it pretty hard to where it's a little bit uncomfortable for for the mom. But it starts to harden up, and you'll feel it harden up, and then that bleeding will stop. So we want to make sure we continue to massage that until it becomes firm, or if the bleeding continues. So you'll want to get mom all cleaned up, and get her covered up, cleaned up, all of that. Now, if the newborn doesn't breathe on its own within the first minute after birth, we'll want to start following some of our BLS things, which that skill drill has it all listed out. Now, a couple of different complications of pregnancy and childbirth. Ectopic pregnancy is one of them. Ectopic pregnancy occurs when a fertilized egg becomes implanted in the fallopian tubes rather than in the uterus. So where I was telling you about how those eggs move through the fallopian tubes, that's the problem, is it stops there and it becomes implanted in there. And then the embryo starts to grow, it expands and causes that fallopian tube to rupture because the baby's been growing and where it's not supposed to be. That can cause some shock. This rupture, it can cause some shock, internal bleeding, acute abdominal pain. So for these patients, we'll treat for shock and make sure we're getting them to the right place, whether that's with us or responding ambulance. Miscarriage and vaginal bleeding. So a miscarriage or another term for that, spontaneous abortion. That's the delivery of an incomplete or underdeveloped fetus. If a miscarriage occurs, you want to make sure that we save the baby and all the tissues that pass from the vagina, control the woman's bleeding and treat her for shock, and then make sure we're getting her to the right place. So anytime a woman experiences vaginal bleeding, that can be the first sign of a miscarriage. So sometimes we want to make sure that we do a good patient assessment. We want to make sure that we're getting good medical history, some vital signs, kind of look to see if she is maybe in shock or headed that direction. We want to make sure that we're arranging for a prompt transport, so we have EMS coming, or if we are EMS, that we're getting her where she needs to go. Now, obviously, there's going to be a lot of emotional, be emotionally charged, this situation. So this can be a little bit hard because, if mom just lost a baby, then it can be a problem. So be patient and show a little bit of comfort and care, and we'll move on. So any newborn weighing less than 5 pounds, we're talking about premature birth, so 2 kilograms, or delivered before 36 weeks of pregnancy, they are considered premature. Premature newborns they're smaller and thinner, and usually redder than full-term newborns. And we want to keep them warm because they lose heat rapidly. Everything hasn't started working quite right within their bodies, and they lose heat very rapidly. The normal babies, that aren't born prematurely, they lose heat very quickly. So these guys really will. So we want to make sure that we're getting them where they need to go. An unbroken bag of water. So the amniotic fluid, right? We're talking about the sac there. It does not break. So you'll need to carefully break it and push it away from the newborn's nose and mouth so they can breathe. Want to make sure that we are very careful and to not injure the newborn, though, in this process. And then suction the mouth and then the nose to help them begin to breathe. We mentioned that umbilical cord, the prolapse of the umbilical cord. So rare occasions, umbilical cord appears from the vagina before the fetus is delivered. This is a little bit different than it's not wrapped around the baby's neck. This prolapsed cord is where the cord actually just appears before the baby. The cord can be compressed between the newborn and then the mom's pelvis during contractions. What that does is that cuts off the newborn's blood supply. So that prolapse of the umbilical cord obviously can become a serious emergency, and we're going to need to get these guys where they need to go quickly. So you want to get her in a position that raises her hips up. We want to keep everything covered and moist and all of that. We don't want to push the cord back in. When I say moist, we want to keep the cord moist as well. Obviously, O2, rapid transport. Sometimes, depending upon what your protocols are, some standards talk about recommending placing the woman in a kneeling position, and that helps to take the pressure off the cord as well. So you may have to physically manipulate. What we're trying to do ultimately is just get the pressure off that cord, or essentially that baby is not getting any oxygenated blood and no perfusion. So that becomes a real big problem. Now, breech birth. Remember, we're talking about just complications here. So these are all just, we're just listing out a whole bunch of problems. But in breech birth, the newborn's buttocks comes down the birth canal first rather than the head. That's a real problem. So, these breech birth, they slow labor. So there's going to be more time for transport to the emergency department. What we're going to need to do is support their buttocks and legs as they're delivered, and usually the head follows on its own. Sometimes they can certainly get stuck in there. We want to be thoughtful with that, but this is not a normal case. So if the head doesn't deliver within 3 minutes, we want to make sure that we're passing that on and getting this person to the hospital as fast as we can get them there. So we're going to insert a gloved hand into the vagina and use our fingers to keep the newborn's airway open by forming a pocket over the newborn's nose and mouth. Now, in really rare cases, an arm or the leg is the first part of the newborn to appear in the birth canal. That's limb presentation. So limb presentation, extreme emergency, cannot be handled in the field. Sometimes we can have these births, a breech birth, and they'll turn out okay in the field, but limb presentations not so much. They're not going to turn out very well. Now, moving on to stillborn. So sometimes a newborn, sometimes the baby dies in the uterus before the labor begins. So they'll, depending upon how long things have been going on, it could be a rather yucky experience. It could be unpleasant odor, all of that, not exhibit any signs of life. We want to make sure that we wrap that newborn in a blanket, and then we need to make sure that we're helping take care of mom, and maybe we need to get somebody there or whatever that situation is. Multiple births. So another set of labor contractions will begin shortly after the delivery of the first newborn. So we're going to need to, everything that we did for one, we're going to get ready to do for number two. And then we move on to excessive bleeding. So, approximately 1 or 2 cups we mentioned is lost during normal childbirth. In the event that there's more than that, we're going to work on that fundal massage. And if that is not helping slow some of that bleeding down, we are going to make sure we pass that on to the oncoming crew so they understand what they're doing and what they're coming into. So we can place 1 or more clean sanitary pads at the opening of the vagina and elevate their legs and hips. We're going to treat her for shock, arrange for rapid transport. Now, something that is kind of a little bit deeper subject, but we want to encourage the newborn to nurse at the mother's breast. What nursing does is contracts the uterus and can often help stop bleeding. As well as that massaging the uterus, what it does is cause some hormonal changes that can cause the uterus to contract and stop the bleeding as well. So by putting baby on chest to chest with mom, so allowing that skin to skin contact, if baby will actually nurse, that can help. We're going to do that fundal massage. We've got several things that we're able to do to help out with that. Obviously, the woman needs to be examined by a physician when we're talking about a vehicle collision and pregnant woman. They need to be seen by someone. Now, if they're just in this little bitty fender bender and there's no damage, that's up to them. But forces involved in even a minor crash, they can be enough to really injure the mom or the unborn baby. So unless they are able to AMA and they just refuse to go, then they probably need to go be seen by a doctor. If the woman exhibits signs or symptoms of shock, A, B's, and C's, as we've done in the past, we're going to make sure we get O2, but we're also going to have them lie on their left side rather than on their back, unless there's a reason that says they can't. If there are, then we'll elevate the board a little bit. What that does is shift the baby off of their inferior vena cava and allows a much better blood flow because they can actually become hypotensive because of that. Now, in rare cases, in rare circumstances, a crash can be severe enough to kill the mom, but not the baby. So, in the event that that's what happens, we would do CPR for mom anyways, but we want to make sure that we're doing whatever is right. You may need to call your medical director to find out, how this whole thing works and what they want you to do. But when someone needs CPR, we give them CPR, whether they're pregnant or not, but this is just talking about, kind of being thoughtful about maybe being able to, I don't know if the right word is harvest, but be able to get to baby once we get to an ER. And here we are, summary. So make sure you know the differences of the stages of the labor. Make sure you understand that estimating how soon a delivery will occur is crowning and time between contractions. Those are two very important things. We talked about our stages, and then what to do for baby and mom afterwards. And then, of course, your emergencies. So ectopic pregnancies and bleeding and miscarriage and all that stuff. Make sure you pay attention to that. And that is chapter 16, so childbirth. So I'll see you for chapter 17.